Mesothelioma can be a very difficult cancer to diagnose at times, and this is for a number of reasons. Firstly, patients often present with rather non-specific symptoms to their general practitioner, so there can be quite a time until the general practitioner thinks, there's something more sinister going on, we should be concerned about what's going on. So symptoms that the patients often present with are some breathlessness or some chest wall pain. But those are very common symptoms for lots of other reasons. People often have perhaps banged their chest, and that can cause you pain in the side, or they may be breathless for other reasons. So it can be a little while until the general practitioner may think, actually, I'm not happy about this, and the patient needs to have a chest x-ray performed. The chest x-ray often then triggers more detailed investigation because it often shows an abnormality within the lining of the lung. However, even at that point, it can take some time before a clear diagnosis of mesothelioma is established. Although the techniques we have to investigate this are very sophisticated, and we use CT scanners and biopsies of the lung, even those tests can take a while until the diagnosis is absolutely certain and secure. And that's because as a cancer, it requires a great deal of skill from the pathologists to identify and be certain that mesothelioma is what we're dealing with. We may have to take 1, 2, or even sometimes more samples from the lining of the lung before the pathologists are happy that mesothelioma is what is going on.
When we see on the scan that there is a thickening of the lining of the chest wall and we suspect this condition, we can do an operation under general anesthetic where we make a small cut. We go inside with a camera, we can explore, look inside quite thoroughly, take a small bit of the lining of the chest wall so that then we can analyze it under the microscope to try to get a diagnosis so that we can try to treat this condition.
So the role of the MDT or multidisciplinary team is to make sure that the most appropriate decision is made with regards to the patient's care. So the MDT meets twice a week, and in that meeting scans are reviewed, the pathology is reviewed, so the biopsy samples that have been taken will be looked at by the pathologist. And there are a variety of specialists in that meeting, from surgeons, chest physicians, oncologists, specialist nurses, and as I mentioned, the pathologist and the radiologist as well. And really the idea of the MDT is that you've got a group of specialists discussing a case and coming up with the best plan for the patient and an individualised plan to make sure they receive the most appropriate treatment.
I had been having treatment for something else, for hemorrhoids, and I had to have CT scans done of my stomach and lower abdomen, and mine was picked up on my diaphragm. So we were referred to Patworth. I remember the day, sitting in the day unit talking about it. We were asked a lot of questions. I remember cancer coming into it. I think we both broke down because we thought, could this be cancer? We didn't know. I remember going to having the CT guided biopsy, which was a pain because I had to lay in one position for quite a while. I did the samples, we had that done. That from then on to diagnosis, that was probably the worst, probably one of the worst weeks I've ever had in my life, because we didn't know. I was optimistic that it was going to be fine, but you do have that little niggle in the back of your mind thinking, well, could it be something else? I remember the diagnosis again, just the whole world falling down, being told that you've got cancer. And it's just, again, it was just a whirlwind after that, having that done. I remember we had to have a PET scan done to see if it had gone anywhere else in the body, which it hadn't. Then we spoke to Mr. Scarchi, who's at Patworth. He came and see us and talked about that he wasn't certain that it was mesothelioma, that he thought it was something else, and he would like to go in and do a VATS biopsy, which he did.
Because of your age?
Yes, because of my age.
He didn't think,
yeah.
I think he was shocked that...
Yeah, that I'd had it at such an early, because I'm so young. So I had my VATS done. I was basically in and out for that. because I just wanted to get on. He then come back. I think they took about, I remember him saying they took about 20 samples, and they had sent some of them away, and they come back and confirmed that it was mesothelioma.
I wasn't actually told the diagnosis originally. What happened was that I went to the doctors on a completely different illness, and they gave me some x-rays, and they said yes, and they diagnosed me with the other illness, which was lupus. And then I had a phone call from Papus saying the x-rays that we have aren't correct, so we need to take some more x-rays. I then went to Papus, had the x-rays. I then went and saw Mr. Sarchi, and he said that there are some spots on your lower left lung. We'd like to have a look at them. So I was giving I forget the medical term, but they put a camera inside my left rib, had a look at it. And when I was, after they'd had given me the information, they said, come back in 6 months because we're still not sure. And 6 months later, they gave me a biopsy. And that was when they told me, yes, you have got mesothelioma. And in a lot of ways, it was funny enough, and it seemed strange. It was a relief, because after all that had been going on, I realised that there was something going on.